Let's talk more about diagnosis through the nose, its physical changes. Changes in the physical shape of the nose are also indicative of the pathological changes in the viscera, which often can be determined by observing the outward appearance of the nose, whether there are spots on the nose and whether there is anything unusual in the secretion of mucus. The nose of a normal, healthy person is usually proportionate in size with a straight ridge and a good outward appearance, all of which indicate good health. Abnormalities occurring with the physical form of the nose usually mean that there are problems with the person's health. The changes in the behavior of the nose also reflect some internal diseases in the human body. Example, a frequent runny nose may suggest chronic rhinitis, which deserves attention. Here we have a red and swelling nostril. This is often caused by endogenous heat, mainly found in the initial onset of nasal sores, boils, furuncles, or eczema. And here we have a red nose accompanied by papules. The tip of the nose may be red, accompanied by papules, and the affected skin may become thicker after a while and turn purplish red. This is often caused by stomach heat fuming upwards to the lungs and blood clogging the lung meridian. In this diagram, we see a crooked nose. This is often associated with a foot and is often accompanied by foot pain. It is also seen in people with facial paralysis. Here we have a turbinate hypertrophy. This means hypertrophy of the inferior and middle turbinates is often caused by mucosal hyperemia or blood stasis. It is likely a symptom of the onset of diabetes or gout. Here we have nosebleeds. Nosebleeds may be caused by wind heat clogging of the lung, hyperactivity of stomach fire, liver fire flaring up and affecting the lung, or the deficiency of kidney yin. Now, tips for caring for your nose. Wash your nasal cavity with cold water to improve the blood circulation in the nose and prevent the onset of common colds and respiratory ailments. You can also massage the nose. Use your thumb and index finger to pinch the base of the nose and push and pull it up and down 12 times, which will enhance the resistance of the nasal mucosa. Alleviate redness in the nose. Your nose becomes red because there's some problem with your spleen and stomach, such as excessive heat in the spleen and the stomach. Massaging the Suzanne and nating points can relieve heat in the stomach. Massage for 5 minutes twice or 3 times a day. Nosebleed. When our nose bleeds, we assume a reclining position and the blood will collect and congeal at the front part of the nasal cavity, which is conducive to stop the bleeding. Do not tilt your head backwards, which will cause the blood to reverse back to the mouth or throat and flow into the stomach, leading to symptoms such as nausea and vomiting. Alternatively, you can massage the yin shan point, which helps clear the orifice and invigorate the meridians and stop the bleeding. Massaging this point can also relieve nosebleeds and symptoms such as stuffy nose, rhinitis, and facial paralysis. Thank you for your attention.
Let's discuss interviewing types of pain, part 2. Pain with a feeling of fullness. This is an ache or pain accompanied by a sensation of fullness. It usually occurs only in the epigastrium or lower abdomen. A sensation of fullness should be distinguished from distension. With distension, the patient feels bloated, like a drum. The area feels like a drum on palpation, and the distended abdomen can be seen on observation. With fullness, the patient feels very full, as if after a very heavy meal, perhaps also with a slight nausea, and the area feels hard rather than distended on palpation. The distension can be seen and palpated. Fullness cannot be seen but can be felt on palpation. Typically, pain with a sensation of fullness indicates retention of food and is related to the stomach and spleen. Pain with a feeling of fullness is usually a full nature. Fullness is treated with digestive herbs. Remember, distension and fullness are not the same. Distension manifests with a bloating feeling, whereas fullness manifests with a full feeling. Next is pain with the feeling of emptiness. Pain with the feeling of emptiness indicates either qi and blood deficiency or kidney deficiency and often occurs in the head. Next is the pain with the feeling of cold. Pain with the feeling of cold is usually a sharp, stabbing, or spastic pain that's clearly accompanied by a pronounced feeling of cold or even shivering, and that is alleviated by the application of heat. This type of pain usually occurs in the abdomen or limbs and indicates full or empty cold. Next is the burning pain. Burning pain is accompanied by a burning sensation and always indicates heat or empty heat. It may occur in the epigastrium or in the limbs. Next is the colicky pain. This is a sharp pain or a colicky cramping nature. It occurs in the epigastrium or more usually the lower abdomen. This pain usually indicates cold in the intestine, but is also maybe due to cold stasis. In gynecology, this pain is seen in dysmenorrhea from cold in the uterus. Colicky pain is of full nature. The third eye is spastic pain. This is a sharp pain accompanied by spasm, meaning contraction, or a sensation of spasm. It usually occurs in the limbs and is related to the sinews and therefore the liver. It may be due to liver blood deficiency in conjunction with liver qi stagnation or liver yang rising. In the latter instance, it may also occur in the head. Spastic pain is either of a full nature or a combination of deficiency of liver blood and fullness, the stagnation of qi. Next is pain with a distressing feeling. This indicates a pain or ache usually in the epigastrium or chest, accompanied by a restless, undefined, anxious feeling and perhaps palpitations. It is usually due to retention of phlegm in the epigastrium affecting the heart. It is also a typical symptom of rebellious qi in the penetrating vessel, causing anxiety and palpitations. This type of pain is usually due to a combination of deficiency of the liver, spleen, or kidneys, and a fullness, the rebellious qi. In gynecology, this type of pain is seen in menopausal problems. Thank you for your attention.
Let's proceed to pattern discrimination, biomedical diseases. Modern biomedical disease entities can also be subjected to pattern discrimination. In fact, this is commonly done in the integrated practice of biomedicine and TCM, both in China and the West. Diseases such as chronic gastritis, diabetes mellitus, essential hypertension, multiple sclerosis, rheumatoid arthritis, endometriosis, depression, coronary heart diseases, and others present with different patterns of disharmony depending on their stage of evolution and the condition of the patient. This allows for a more integrated and individualized approach to diagnosis and treatment, which frequently allows for more effective clinical results. Pattern discrimination determines treatment. Pian Cheng Lun Chi. As previously explained, the diagnostic information obtained by the four methods is analyzed and interpreted to construct an image of the patient's health and pathogenic tendencies, which is the underlying pattern of disharmony, even if no actual disease is present. This image is what determines a principle for intervention, which in turn suggests to the practitioner which therapeutic tools may cure, alleviate, or prevent disease. Correct pattern discrimination is an indispensable prerequisite to effective treatment of disease in TCM. Same disease, different treatments, different diseases, same treatment. Tong Ping Yi Chi, Yi Ping Tong Chi. Because any given disease may exhibit different manifestations at different stages, we know the underlying pathogenic process also changes. As the underlying pattern of disharmony of a disease changes, so too must treatment. This is what is meant by the adage, same disease, different treatment. Conversely, certain stages of development of various seemingly unrelated diseases may be caused by the same underlying pattern, which makes it possible to use the same treatment for all of them. This is what is meant by different diseases, same treatment. TCM theory postulates that the body has a set number of possible reactions to pathological changes, each of which can lead to a large number of potential manifestations, that is, diseases, and that the evolution of a pathological condition may cause the body to react in different ways. For instance, 3 patients, all diagnosed with type 2 diabetes, may, according to TCM, present with 3 different patterns: yin deficiency with exuberant heat, qi and yin dual deficiency, and kidney yin and yang dual deficiency. Each of these would require different treatment. Health and disease is continuum. In order to better appreciate the potential of TCM diagnostic tool, it is important to discard the view that health and disease are 2 opposing static states. Health and disease occur along a continuum, a constantly moving dynamic process of adaptation to situation and circumstance, which can be influenced through treatment that is sensitive to its mutable nature. A patient requesting treatment must be diagnosed in order to determine the pattern of disharmony at work. However, it is understood that once treatment is implemented, the pattern can and will change as a result of various influences. Therefore, the practitioner must re-evaluate, re-diagnose, and adjust the treatment accordingly. At times, the pattern may change so dramatically as to require an entirely different treatment. This is where the adaptability of TCM's therapeutic methods, like acupuncture, herbal therapy, diet, bodywork techniques, really shines. Integrative approach. Ideally, all cases should be approached with a view towards integration, including comprehensive information gathering, followed by the interpretive approach of TCM pattern discrimination, with an open mind to the possibility of further investigation and treatment using the tools of biomedicine. The best of both systems can be applied to the greatest benefit of the patient. The temptation exists in clinical practice, especially in the treatment of pain, to resort to a more symptomatic approach to alleviating patient suffering and to lose sight of the larger integrative view in the process. It is important to avoid doing this, regardless of whether one practices biomedicine or TCM. In order to provide specific, long-lasting curative effects, it is frequent for practitioners of biomedicine to find themselves without a clear diagnosis, even after numerous diagnostic procedures. The approach of the TCM practitioner requires no time-consuming, sophisticated procedures, as diagnosis and pattern discrimination can always be performed, allowing suitable integrative treatment to be delivered without delay. We owe it to our patients to be comprehensive and look deeper than the outward manifestations to examine the functional relationships at work behind the patient's present condition and to address them with treatment. Thank you for your attention.
Let us go to the differential diagnosis of Western and CM. The topic is common cold and influenza. So first, let's look at the Western differentiation of common cold and influenza. Number 1 is common cold, an upper respiratory infection caused by a cold virus. The signs and symptoms that usually begin 2 to 3 days after infection may include runny nose, nasal congestion, sneezing, sore throat, postnasal drip, cough, and headache. The cause The causes are commonly by rhinoviruses and coronaviruses. Cold spread by airborne droplets when a person coughs or sneezes, or by hand contact. The risk factors are for children to tend to have more colds than adults. Adults have built up immunity against some viruses. And number 2, influenza, an upper respiratory infection caused by a flu virus. The signs and symptoms is sudden onset of fever, sweating and feeling ill, general muscle aches and pains, tiredness, malaise, dry chesty cough, sneezing, running or blocked nose, and difficulty sleeping. The causes of influenza is the influenza virus family contains 3 main types, A, B, and C. Influenza viruses are known to mutate over time. Influenza A occurs more frequently and is more serious. It regularly giving rise to pandemics. And the risk factors is flu can develop into a high fever, acute bronchitis, encephalitis, and pneumonia. Risk of serious illnesses is higher in the elderly, specifically over 65, babies and infants, and people with chronic illnesses. For Chinese differentiation, diagnostic questioning would be according to number 1, the 4 levels or aspects. The number 1 is the defensive qi or wei qi aspect, which is wind heat. Then there's qi aspect, external heat, strong body with organ function impaired but not badly. Heat either in the chest and diaphragm, stomach channel, or Shaoyang channel. The next is nutritive qi or construction or yin aspect. The heart function is impaired, heat leading to burning of yin. And then there's blood aspect, where there's exacerbation of nutritive level, with heat causing bleeding like encephalitis, meningitis, and acute leukemia. And number 2 is the 6 divisions. There's Taiyang, which is the bladder and small intestine, the Yangming, the stomach and intestines, where there's strong pathogen, strong body, and heat. The channel stage and organs are not affected. In the organ stage, where there is desiccating heat in the intestine, constipation, and delirium. And then there's Shaoyang, the gallbladder, and Sanjiao, which is mid-stage disease, half exterior, half interior. And number 3, symptoms of phlegm. So we look at the location, if it's in the nose, throat, or if it's vomited. We also look at the cough, if it's dry, productive, loose, weak, or forceful. And of course, the color and nature of phlegm, if it is white, yellow, clear, blood-tinged, watery, thick, or sticky. Then there's the Zhangfu organs. The first is the defensive qi aspect, where there's wind cold invading the lung, wind heat invading the lung, wind dryness invading the lung. Or the qi aspect, there's lung heat, phlegm heat obstructing the lung, stomach heat or fire, gallbladder heat, and damp heat in the stomach and spleen. There's nutritive qi aspect, where there's heat in the pericardium, and blood aspect is heat in the blood, and heat leading to stirring of internal wind, yin deficiency with lodged evil. Thank you so much for your attention.
We talk about full viscera and irregular organs. This time we focus on the small intestine. The small intestine, a rather long tube-like organ, is located in the abdominal cavity. Its upper end connects with the pylorus of the stomach, and its lower end connects to the cecum, which is the beginning portion of the large intestine. The main physiological functions of the small intestine include the following 2 aspects. So here we take a look at both the small and large intestines. And as we can see from the illustration, we know where the liver and the gallbladder are located. And the small intestine, the large intestine is supposed to be involved in transportation of wastes. Then we have the stomach, the small intestine. So if there is a dysfunction of the transporting function of the large intestine, there will be dampness, heat in the large intestine characterized by constipation. So for the small intestine, the function is to receive and process food and drink. And this will, if there is an imbalance in the small intestine, this will cause contraction and dilatation. So with dilatation, there will be an impact on absorption of the essential nutrients and the transporting of waste by the large intestine. So basically, the function of the small intestine is to separate the clear from the turbid. So let's go to the functions. Reception and absorption. The plain question states, the small intestine is a receiving organ. It transforms matter. This has two meanings. First, the small intestine receives the partially digested chyme from the stomach. Second, the chyme remains in the small intestine for a while for further digestion and transformation into the nutritive substances necessary for nourishing the entire body. If the functions of the small intestine are abnormal, disruption of digestion and absorption may ensue. This may cause abdominal distension and diarrhea with loose feces. The second function is separating the clear from the turbid. The clear refers to the essential substances, while the turbid refers to the waste left by digestion. The separating function of the small intestine separates the chyme into three parts and sends each part on its proper path. The essential nutritious substances are conveyed to the spleen to be distributed to the entire body. The detritus is conveyed to the large intestine. The unusable fluid is conveyed to the urinary bladder, eventually to be excreted. If this separating function is disrupted, there may be mucoid diarrhea and turbid urine. Thank you for your attention.
Let us continue our subject on diagnosis according to Zhangfu organ patterns. The small intestine qi stagnation. The small intestine receives the untransformed residues from the stomach. After further processing, the turbid fluids are sent to the urinary bladder, and the impure dregs are sent down to the large intestine. Stagnation of qi in the small intestine can inhibit the descent of qi in the small intestine and thereby disrupt the transformation of fluids that takes place here, as well as causing pain and discomfort. This pattern is usually a pure qi pattern, but there can be a deficiency aspect as well when spleen and stomach qi deficiency result in stagnation in the small intestine. Etiology. Frustration, irritation, repressed anger, pent-up emotions, and stress can all stagnate liver qi. Stagnant liver qi can then invade the small intestine and interfere with its qi mechanism. Worry, speculation, and excessive thinking can bind spleen qi and disrupt the stomach and spleen's qi mechanism. This can then disrupt the movement of qi and the functioning of the small intestine. Excessive sitting and sitting in a twisted or slumped posture will physically block the movement and function of the small intestine qi. An excessive consumption of food and beverage that are energetically and physically cold or that produce dampness can weaken stomach and spleen qi and thereby the small intestine. The symptoms and signs. There will be abdominal bloating, discomfort at palpation of the abdomen, pain in the lower abdomen, which can radiate to the back. The pain is aggravated by pressure. Discomfort when wearing tight clothing on the abdomen. Borborygmi, flatulence, intestinal pain that is relieved by passing wind. Constipation, testicular pain. There may be signs of liver qi stagnation. White tongue coating, wiry pulse, especially in qi position. Key symptoms: abdominal pain, borborygmi, wiry pulse. The treatment principle would be to regulate and move qi in the small intestine, possibly regulate liver qi. Acupuncture points would be to choose from Ren 6, Sanjiao 6, gallbladder 34, liver 3, liver 13, stomach 27, stomach 29, spleen 4, spleen 6, and stomach 39. Needling technique would be spreading and moxa can be used. Explanation: Ren 6, Sanjiao 6, stomach 27, and stomach 29 move and regulate qi in the small intestines. Gallbladder 34, liver 3, and liver 13 spread liver qi. Spleen 4 and spleen 6 tonify spleen qi and regulate qi in the small intestine. More relevant advice. As well as addressing any emotional issues that may lie behind their qi stagnation, the patient must ensure that they get enough exercise. A short walk after eating is recommended. If this is not possible, stretching and light abdominal massage would be beneficial. Abdominal massage, where the movement is in a clockwise direction, will help circulate qi in the intestines. Posture is important, especially when the person eats and immediately afterwards. Sitting straight and standing erect ensures that there is a free passage through the abdominal cavity. The small intestine qi stagnation can be caused by the following patterns of imbalance: liver qi stagnation, food stagnation, cold stagnation, stomach and spleen qi deficiency. The small intestine qi stagnation can result in the following patterns of imbalance: liver qi stagnation, stomach and spleen qi deficiency. And to summarize, small intestine qi pain, etiology, excessive consumption of cold and raw foods, emotional states like anger, frustration, and resentment. The underlying and accompanying pathology: stagnation of liver qi, there will be liver qi invading the spleen, spleen qi deficiency. The signs and symptoms would be lower abdominal twisting pain, which can extend to the back, abdominal distension, dislike of pressure on the abdomen, borborygmi, flatulence, or abdominal pain relieved with the passing of wind, pain in the testis. The pulse would be deep, wiry, especially in the rear positions. The tongue will have a white coating. Treatment principles: force the liver and move qi in the lower burner. Stop abdominal pain, harmonize liver and spleen. Acupuncture treatments would be REN 6 to move the qi in the lower burner, liver 13 that harmonizes the liver and spleen. Stomach 29 stops pain, stimulates small intestine. Liver 3 relieves stagnation of liver qi. Gallbladder 34 moves stagnation, relieves pain. Stomach 27 moves qi in lower burner. Spleen 6 stops abdominal pain. Stomach 39, lower C point of small intestines. Needling with drainage. Thank you for your attention.
Let's discuss etiology in Chinese medicine. The diet, maladjustment of work and rest. Diet maladjustment of work and rest. First, the impairment due to improper diet. Food and drinks are the source of nutrients that are indispensable substances for maintaining the vital activities of the human body. An improper, unclean, or unbalanced diet often causes illnesses. Since food and drinks are digested and absorbed by the spleen and stomach, an improper food mainly impairs the spleen and the stomach, leading to dysfunction of the ascent and descent of spleen and stomach qi. It can also lead to the accumulation of dampness, the formation of phlegm, the generation of heat, or transformation into other illnesses. Next, the unregulated intake. The amount of food and drinks should be appropriate, as excessive or inadequate food and drink may cause disease. If intake is insufficient, the source of generation of qi and blood is reduced and they lack sufficient nourishment. Over a period of time, this may result in deficiency of qi and blood, leading to illness. Conversely, an excessive indulgence can overwhelm the capacity of the spleen and the stomach to digest, absorb, and transport. This can lead to retention of food, injury to the spleen and stomach, and cause such symptoms as abdominal distension, fatigue, eructation, acid reflux, and anorexia, vomiting, or diarrhea. The plain question states too much drink and food can injure the intestine and the stomach. Indeed, indulgence in fats and sweet food is likely to engender endogenous heat, sometimes producing carbuncles, gangrene, and skin ulcers. Next, the contaminated food and drinks. Eating food or drinks that has been contaminated or has spoiled can lead to a variety of stomach and intestinal disorders. This produces such symptoms as abdominal pain, vomiting, diarrhea, and dysentery. Doing so can also cause parasitic infestation such as roundworms, pinworms, or tapeworms, and this can produce abdominal pain, pica, and emaciation. Sometimes contaminated or spoiled food or drinks can contain poisons, causing severe abdominal pain, vomiting, or diarrhea, and in severe cases, coma or death. Number 3, unusual cravings and imbalance. Food and drink should be appropriately regulated without unusual cravings or imbalance in order to ensure that the body receives all the necessary nutrients. If food and drinks are too cold or too hot, or there are unusual or unbalanced cravings, the equilibrium of yin and yang may be disturbed, or sometimes essential nutrients may become lacking. Essence, vitality, chi, and blood are all nourished by the 5 flavors, and the 5 flavors have affinity for the sangbisira respectively. According to the plain questions, when the flavors enter the stomach, each seeks its preference organ, preferred organ. The sour first goes to the liver, the bitter first goes to the heart, the sweet first goes to the spleen, the acrid first goes to the lungs, and the salty first goes to the kidney. If there is sustained preference for any one flavor, that corresponding sang organ may become overly stimulated, and over time there may be injury to the visceral organs. The internal classics has pointed out this correlation. Excessive intake of sour foods can overstimulate the liver and impair the spleen and lead to a thickening and wrinkling of the skin and parched and cracked lips. Excessive intake of salty food can overstimulate the kidney and impair the heart and lead to sluggish circulation, tightness of the chest with shortness of breath, and a luster complexion. Excessive intake of sweet foods can overstimulate the spleen and impair the kidney and lead to darkening of the complexion, tightness of the chest with shortness of breath, lumbar and knee aches, and hair loss. Excessive intake of bitter foods can overstimulate the heart and impair the lungs and lead to a loss of moisture from the skin and loss of body hair and disharmony between the spleen and stomach. Excessive intake of acrid foods can overstimulate the lungs and impair the liver and lead to dull and dry nails and spasm of the sinews. Thus, the diet should balance the 5 flavors appropriately and avoid strong preference. A proper diet is especially important during an illness and should be adjusted throughout the course of the illness. This will help the treatment and speed the recovery. Conversely, the illness may be aggravated. Strong preference of either hot or cold foods can also indulge illness. For example, excessive intake of cold, raw food can injure the yang qi of the spleen, the stomach, and engender exogenous cold and dampness and lead to abdominal pain and diarrhea. Excessive intake of acrid or hot foods can induce heat accumulation in the stomach and intestine and lead to thirst, abdominal distension and pain, constipation, or hemorrhoids. An appropriate intake of alcoholic drinks can promote blood circulation and loosen up the sinews, but excessive intake over time can lead to disease. The nature of alcohol is hot and damp, and its excessive intake can injure the spleen, the stomach, and the liver so that endogenous dampness and heat can engendered. Clinically, such symptoms are abdominal distension, reduced appetite, bitterness, and greasiness in the mouth, and a thick and greasy tongue coating can appear. So we have here the illustration of other internal causes of illness, the supernutrition, the pathology of obesity. We have the hyperlipidemia, hypertension, diabetes, coronary heart disease, the arteriosclerosis, cholecystitis in gallstone. We have also the normal labor, overease, overstrain, overthinking. With the high carbohydrate diet, high fat diet, high protein, preference for strong flavors and drinks, raw, cold food and drinks, pungent or hot food, alcoholic intemperance vegetarian diet for a long period of time could result to malnutrition and leading to qi insufficiency or spleen and stomach. With the eating of sprouting potato, toxic mushroom, water hemlock, stramonium, puffer fish, having a bacteria, virus, unclean food and drinks, pathogen, parasites can lead to belching, acid regurgitation, vomiting, diarrhea, abdominal pain, dysentery. Thank you for your attention.
Let's now talk about the emotions. This time, let's discuss shock. Mental shock scatters qi and affects the heart and kidneys. It causes sudden depletion of heart qi, makes the heart smaller, and may lead to palpitations, breathlessness, and insomnia. It is often reflected in the pulse with a so-called moving quality. A pulse that is short, slippery, shaped like a bean, rapid, and giving the impression of vibrating as it pulsates. Here is a clinical picture of shock, manifesting with palpitation, shortness of breath, insomnia, and a moving pulse. The simple questions in chapter 39 says, shock affects the heart, depriving it of residence. The mind has no shelter and cannot rest, so that qi becomes chaotic. Shock also closes the heart or makes the heart smaller. This can be observed in a blue stitch on the forehead and a heart pulse which is tight and fine. There is a flow diagram of the effects of shock. First, it can suspend qi, and it can lead to heart qi deficiency and heart qi stagnation. Second, it can deplete qi and can lead to kidney qi deficiency. Shock also affects the kidneys because the body draws on the kidney's essence to supplement the sudden depletion of qi. For this reason, shock can cause such symptoms as night sweating, dry mouth, dizziness, or tinnitus. So to summarize, shock, in mental shock, scatters qi and affects heart and kidneys. It causes a sudden depletion of heart qi and makes the heart smaller. Shock also affects the kidneys because the body draws on the kidney essence to supplement the sudden depletion of qi. Thank you for your attention.